Introduction to Palliative and End-of-Life Care. Introduction. Nursing and residential care homes are increasingly the place where people nearing the end of life will live and be cared for until their death. Many of these people are living with multiple chronic conditions, and therefore require more complex interventions. By 2020, the number of people over the age of 75 years is expected to increase by 40%, with those aged 85 and over expected to increase by 58%. Historically, people with cancer predominantly accessed palliative care. However, it is increasingly recognized that those living with advanced non-malignant diseases may also benefit from access to palliative care regardless of care setting. Given that the prevalence of chronic conditions and dementia increases with age, demand for palliative and end-of-life care services is likely to increase as the population ages and more people live with the consequences of physical and/or cognitive frailty. The average length of stay has now reduced significantly, with many residents' conditions deteriorating much more quickly, adding to the complexity and higher dependency levels within care homes. These guidelines build upon what has already been achieved with the implementation of the DHSSPS nursing home and residential home minimum standards. These guidelines will build upon what has already been achieved and are not intended to replace existing clinical guidance but rather provide best practice regarding systems and processes. They should be used in conjunction with current palliative care clinical guidelines, including Palliative Adult Network Guidelines and General Palliative Care Guidelines for the management of pain at the end of life in adult patients. Policy context. The aim of these guidelines is to enable staff within the nursing and residential care home setting, in collaboration with other members of the health and social care team, to provide consistent high-quality palliative and end-of-life to residents and their families. The guidelines are designed to support the minimum care standards for nursing and residential homes, and regional strategic documents which promote continuous quality improvement, including Living Matters, Dying Matters, a palliative and end-of-life care strategy for adults in Northern Ireland.